It's a pleasure to be presenting and joining the ICCP 2020 conference online. I'm Alex Parker, Professor of Physical Activity and Mental Health within the Institute for Health and Sport at Victoria University in Melbourne, Australia. And before I start, I'd like to acknowledge the ancestors, elders and families of the Kulin Nation, who are the traditional owners of Victoria University's land. We also acknowledge all traditional owners of country throughout Victoria and the traditional owners of the land where all of us are located in joining this presentation today. As we share our own knowledge practices within the university, may we pay respect to the deep knowledge embedded within the Aboriginal community and their ownership of country. I would also like to acknowledge the funding bodies and the co-investigators involved in the research that I'll be presenting as part of my presentation today. Around 450 years BC, Hippocrates shared some wise words with us that if we could give everyone, every individual, the right amount of nourishment and exercise, not too little and not too much, we will have found the safest way to health. And it's really challenging to say that 2,500 years later, we're still really struggling with this concept and implementing it and bringing it to life. And the reason why it's so important is from the mental health implications of physical inactivity as one example of this. We know that there's reduced life expectancy of people with serious mental illness compared to the general population. The mortality rate is over 2 times higher, and this equates to about 20 years of life lost compared to those without a serious mental illness. Some of the patient factors that are involved, we know that people with mental illness are less likely to seek help for physical health concerns and perhaps also have a range of poorer lifestyle behaviours such as smoking, poor diet and nutrition. But we also know that there's clinical factors or clinician factors involved, and historically less medical care or lifestyle prevention interventions have been offered for people with serious mental illness. And it's only really recently that there's been more of a focus on the role of behavioural or lifestyle medicine in mental health. And this is examining the ways that we can target modifiable or behavioural, social and environmental determinants of mental ill health that include looking at physical inactivity, poor stress management, poor nutrition or diet, and a range of other things as well that we know impact on our mental health and well-being. This has become a recent focus over the last couple of years. And for example, there's a great commission series in the Lancet Psychiatry last year looking at protecting the physical health of people with mental illness. And this taps into this point that I mentioned before, that less lifestyle interventions or prevention interventions are offered for people with serious mental illness. So this blueprint provides us a way to think about delivering mental health services in a different way and prioritising the physical health concerns of people with a serious mental illness to do our best to address that mortality gap. The reason why I have focused in some of my work on looking at youth mental health is that when we do look at the burden of disease by age, we can see that the majority of conditions that have the most impact on the health burden for young people aged between sort of 15 to 25 years are mental disorders. That's why they're often referred to as the chronic diseases of the young. And as we age, other diseases impact more on the burden of health. And also it's really important to have a look at what we're offering as first-line treatments. And I've specifically focused a lot of my work on depression in young people. And there's serious limitations of what we currently offer as first-line treatments, guideline concordant treatments. So we know that psychological treatments and medications, they're modestly effective. So that's even best practice cognitive behavioural therapy and selective serotonin reuptake inhibitors as medications for depression, which means that many young people, in fact, the majority of young people, do not reach remission after treatment with one of these gold standard treatments. So we do need to consider additional or adjunct therapies, particularly non-pharmacological therapies, because they've got high acceptance in young people. And combination treatments might also help to boost the treatment effects. So the role of physical activity is from a prevention point of view through to treatment point of view. So looking at mental health on the continuum, we can see that physical activity has a role to play in health promotion and universal prevention, so helping to maintain the mental well-being of people who are mentally healthy. For those in the middle of the continuum who are starting to experience some mental health concerns, physical activity can be effective in indicated or targeted prevention. And for those who have mental illness, there's evidence to show that it has a treatment's effect, so it's a strong intervention, and it also can help prevent the onset of physical health comorbidities as well. So, when I'm talking about physical activity and exercise, I just want to really briefly have a look at these definitions. So, a traditional definition from Casperson and his team back in the 1980s is that physical activity is any bodily movement that increases energy expenditure. And so, it can include things like playing, working, active transport, household duties, recreational activities as well. Whereas exercise is a subcategory of physical activity. It's planned, it's structured, it's repetitive, it's purposive. I've always struggled with that word, in the sense that it can help improve or maintain physical fitness as being the objective. When we think about how we apply this to mental health and well-being, there's a new definition that Piggin out of Loughborough University in the UK has put forward in his publication this year, that we need to consider the environmental, social, and a whole range of other determinants on how people engage in physical activity. And his definition is that it's people moving, acting, and performing within culturally specific spaces and contexts, and influenced by an array of interests, emotions, ideas, instructions, and relationships. So you can see it's far more complex than simply moving more from your baseline expenditure and energy expenditure level. And Biddle and Muttrey and their new books, I think, and new editions about to come out next year, really put this on the page for physical activity and mental health researchers over a decade or over 2 decades ago. That thinking about physical activity, it's a chosen activity. It's freely chosen in our leisure time, or we need to consciously integrate it into our daily routine. So this justifies the importance of understanding or studying psychological processes such as motivation or decision making, and how these influence our engagement in physical activity for our well-being. Over the past couple of years, we've had a close look at the emerging evidence in using physical activity to prevent and treat mental illness in young people. So results from our narrative systematic review has 11 included studies. 8 of these were RCTs and 3 were observational studies. And as you can see from the findings, just generally looking at the type of interventions that were offered, it was really broad. So some aerobic exercise, high intensity, CrossFit, yoga, cycling, and tended to be compared to sort of passive control groups or usual PE lessons. And the data emerging from this is showing that physical activity does have some benefit. So the designs of these studies were not true prevention studies, in the sense that they were trying to look at preventing the incident or the onset of new episodes of depression in young people, but instead showed evidence that young people that had elevated symptoms of depression did show some reduction in those symptoms at the end of these physical activity interventions. When we look at the treatment perspective, so young people that actually do have either diagnosed depression or symptom measures over a certain threshold, we can see that our meta-analysis, in combining the available literature, shows a strong, medium to strong effect size in favour of physical activity interventions. Most of these physical activity interventions were group-based. They were mainly delivered to students in school or tertiary education settings, and tended to focus on aerobic exercises as well. And it seemed to be, such as group running, and it seemed to be important that there was some supervision element involved in this, rather than it being a self-determined activity. We've also had a look more broadly across all interventions that affect young people, not just depression, and have done a scoping review that was published earlier this year. Had 30 included studies when we were looking at promotion or prevention of mental illness. Interventions of varying intensity tended to lead to reduction in depressive symptoms, but moderate to vigorous or light intensity interventions seem to reduce anxiety symptoms. And there seem to be some additional mental health benefits shown, such as on eating disorders or other symptoms, but were really limited due to the few studies that were involved. So our conclusion from this scoping review was that physical activity and exercise show promise for mental health promotion or early intervention, and this warrants further investigation. We had a twin scoping review that looked at using physical activity as part of mental health treatment. There were 16 included studies here, with moderate to vigorous intensity interventions seeming to be beneficial for young people in treating depression, and mixed evidence for other intervention intensities for other mental disorders. So we concluded that physical activity shows promise for a range of mental health outcomes, but it really does require further development for this aspect of the research. Tailored or individual interventions based on young people's preferences may be an important component of effective interventions as well. I'd also just like to briefly look at how, from a sort of a case example of how physical activity can be embedded within within mental health treatment, and having a look at a case of a young person who has depression and social anxiety. Some of the thoughts that this young person had was that she was boring or inadequate, useless, worthless, unlovable, that she never does things right, things will never be able to change, and there's no point in trying. She had a 3 to 4 year history of severe social anxiety and depression when we began working together. Some of the behaviours, she was very fidgety and restless and unable to relax, very strong avoidance behaviours. She wasn't able to leave the house when we started working together, a lot of social isolation and withdrawal, and unable to concentrate. And then some of the feelings that she did have, were feeling overwhelmed, distressed, guilty, irritable and frustrated, and persistent and excessive worries and fears, and lacking in confidence. So seeing, the reason why I mention this, because it's very important when thinking about including physical activity as part of treatment, that it should be formulation driven and linked to a young person's presenting issues. So I'd like to just give some examples about how we embedded or weaved physical activity into the treatment that we did together. And this young person and I worked together for about 8 months with sort of semi-regular sessions throughout that time. So through a lot of trial and error, we figured out that the timing of when she engaged in physical activity was really important. Doing it in the morning and doing some vigorous activity in the morning helped to maximise her sense of achievement, and it challenged those core beliefs of feeling useless or feeling not good at anything. And she found that it also disrupted rumination for a few hours as well. So it gave her a different start to the day when she engaged in physical activity in terms of the cognitions. The intensity of her physical activity was important. So, for example, when she started to, halfway through our therapy together, she re-engaged with studies at university and thinking about how she could make it into her tutorial room. We, again, trial and error, and we tried parking the car half an hour from campus, and she would plug in her headphones, listen to some music, and do some mindful walking slowly into campus. So she would notice things like the breeze moving through the trees, listening to her music, calming her heart rate, and was able to walk straight into her tutorial room when she used this method. And also the type of the physical activity was really important. So she did have one really close friend who was very supportive, but her friend's suggestions about managing social anxiety kept coming back to perhaps drinking a bit more alcohol to feel disinhibited, and wanting to sort of go out to the pub and saw that as a way of trying to help her friend with her social anxiety. So we talked about that a lot in sessions. We role played how she could have a discussion with her friend about the appropriate support for her at the moment. And then together they actually talked about it and decided that going to a yoga class and then having a cup of chai tea or peppermint tea afterwards was a far better way of managing her social anxiety at the moment, and to give them something, social connection, in a way that they can connect with each other and support each other during this period as well. So again, 3 different ways of thinking about using physical activity, but all connected to the young person's presenting issues and what she was hoping to achieve from treatment. So to summarise, I'd just like to briefly say that it's really important to think about tailored or individual physical activity interventions, and it seems to be that the evidence is supporting moderate to vigorous intensity when it's done in controlled settings, but some activity is better than none. Anything will have some mental health benefits, particularly if it's done in leisure time or in active transport. It's really important, particularly for any person, but with young people in particular, to think about it being preferenced or tailored to their individual needs to try to maximize enjoyment and short term effective regulation. So, getting some positive affect out of it. And this will enhance their autonomous motivation and their adherence to a physical activity intervention. A multidisciplinary approach is important. Any allied health professional to reinforce this message of physical activity being important for mental well-being. Professional developments required for mental health clinicians and also for exercise specialists who want to work in mental health. And it's really important for them to be delivering effective behaviour change strategies, things that focus on motivational enhancement, goal setting, monitoring of benefits, reinforcement, and self-rewards. And finally, I'll leave the why to a young person who's involved in one of our studies as to why physical activity is so important for treating depression in particular. I found it easier to sort of clear my head when things were not really feeling the best, or if I was feeling particularly horrible about something, instead of sitting there having a cry and thinking about it, I'd go for a bit of a jog. And then at least my head was a bit clearer, so I could think either a bit less about it or just relax a little bit. So it made me feel a lot happier. Thank you so much for joining me with this presentation, and please get in touch if you would like to have a conversation or for more information.